We are going to talk about breast cancer screening. You're welcome to Docker Breast Cancer Foundation. So today we're talking about breast cancer, and that's a presentation we have for you today. So stay tuned. On the table of content, we have several things to talk about, which is what is breast cancer. The second, what are the risk factors? The third, what are breast cancer symptoms? The fourth, what is breast cancer screening? The fifth, what is mammogram? The sixth, how is breast cancer diagnosed? The seventh, how is breast cancer treated? So on the left slide, there's a picture there. It says, keep the fight going, support breast cancer, and donate so we can continue to fight. So to the first one, what is breast cancer? As we all know, breast cancer is a disease in which cells in the breast grow out of control. So there are two types of breast cancer. One is the invasive ductal carcinoma and the invasive lobular carcinoma. So those two types of breast cancer depend on the cells in which the cancer grows in the breast. So the risk factors to see if those cells will grow in the breast. On the left slide, we have a picture. On the left side, we have a picture of the risk factors. Here it says female gender. Yeah, if you're a female, you are at risk of having breast cancer. Advancing in age, that's 20 years. We have family history. We have radiation exposure. We have breast density. We have ethnicity, and we have menstrual period. So yeah, women 20 years and older are at risk of getting breast cancer. There are other risk factors, which are we call it genetic mutation, and I've talked about the family history before. So if you have a family member that has breast cancer, so you're likely to have breast cancer. Talked about the dense breast, also the reproductive history. So reproductive history determines if you are at risk of breast cancer. The symptoms. There are various symptoms of breast cancer, but the one we have listed there are new lumps in the breast or underarm. That's the armpit. You see lumps like balls, thickening or swelling of part of the breast, irritation or dampening of breast skin. So when the breast skin is irritated or dampened, there's redness or flaky skin in the nipple area of the breast, and also there's pulling in of the nipple or pain in the nipple area. As we said, also on the other side, you see a post. That's a picture. We've talked about the visible lumps in the armpit. We did not talk about the pain in the breast and the blood discharge. So when blood coming out of your breast, that's the symptoms of breast cancer. So you need to screen for breast cancer to be sure it is breast cancer. So yeah, early detection is the best protection. So yeah, it says it take less than 30 minutes for breast cancer screening. So what is breast cancer screening? Breast cancer screening is getting your breast checked before the signs and symptoms start to show. So don't wait before you have all those signs and symptoms. You need to do the screening. So one of the screening is mammogram. You can see the nurse or the doctor there screening this woman. That's a mammogram machine to check if she has breast cancer. So a mammogram is an X-ray picture of the breast. Doctors use mammogram to check for cancer in the breast. Having a mammogram will reduce the risk of dying from breast cancer. So get a mammogram today. So breast cancer, how they are diagnosed. We have the biopsy, we have the ultrasound, we have the MRI, that's the magnetic resonance imaging. We have the other one that I showed to you earlier, that's the diagnostic mammogram, where it's an X-ray and it shows pictures of the breast. So ask yourself, if we have all those symptoms, how are we going to be treated if you are diagnosed of breast cancer? So there are local and there are symptomatic treatment. The local treatment is surgery and radiation. Now the symptomatic is hormonal therapy, chemotherapy, targeted therapy, and also we have biological therapy. Breast cancer is treated in several ways, as we all see. Treated in several ways. So get checked for breast cancer. Early detection is key. Save a life today. Thank you. That's the end of a slide.